ahead of time, and we know that we cannot control the weather, nor can you.
I've had the privilege to travel since the governor appointed me to this job, and one thing that I've heard everywhere I've gone are people's stories about healthcare. And I know you shared some of those stories tonight. I'm going to listen to those stories from the staff, but these stories have been the stories that I've used when I've gone to the Senate floor to talk about healthcare. I don't have to go and give a long-winded speech about policy. What I share are the stories of people that we've heard from in these town hall meetings or have come to visit me in Washington. I told the story recently of a woman in Pueblo whose name is Teresa, who had finally been able to enroll her son in SCHIP. It took a long time to do it, but she was able to do it because of the expansion that we all put in place. And then she was so successful at her job, she was offered a higher paying job, which she couldn't take or actually she got a raise. That was the story in her job, which disqualified her all of a sudden from SCHIP, so she had to take a lower paying job. These are the kinds of choices that people are going to make. I believe we will pass comprehensive health care reform this year. And we have no alternative. The people that are opposing this right now are not presenting us with an alternative except for the status quo. And the status quo has meant to our families in the last decade 80% increases in their premiums. It's meant that 7.5 million more, now 8 million more Americans don't have health insurance. It means that 47 million Americans don't have health insurance in this country, and everybody else is subject to these insane double-digit cost increases every single year. And what I've heard from people in Colorado is we want to end these double-digit increases. We want to cover everybody because we know if we're covered today that we're all paying $1,000 to cover people whose health care is the emergency room. And we want you to do this in a way that's fiscally responsible. We don't want you to break the bank. And of course, as all of you know, one of the real problems we have in our deficit are rising Medicare costs. That's one of the most difficult things that we face. And healthcare reform is not only about our economic interest and the moral interest we have in covering everybody. It's also the way that we're going to restore fiscal responsibility to our government. And we need to do all of that. And none of it's going to be easy, and it consists of a lot of tough choices that have to be made. But I believe we'll make them. I think that the reason we will is that the status quo is just unacceptable. We can't have our families suffer through 10 more years like the last 10 years. We can't have our small businesses put out of business as we try to get out of this recession by increasing healthcare costs. We spend as a country 16%, 17% of our gross domestic product on healthcare. Every other country, industrialized country in the world, spends half that on healthcare. We can do a much better job. And so my bill, which is the Medicare Transitions Act of 2009, which I hope is going to be part of the overall healthcare reform that we work on, is a very good illustration of the incredible savings that exist if we will just change these incentive structures and stop paying people to get sick and start paying people to stay well.